1600. Who else do you have responding with it?
I have you, 1611, Alpha 5, and 1211.
An emergency medical responder is often the first medically trained person to arrive on the scene of an emergency. The initial care an emergency medical responder provides is then followed up by emergency medical technicians and paramedics. The skills and knowledge learned as an emergency medical responder provide the foundation for the entire EMS system. All agencies and personnel need to share a mutual understanding of their roles for the EMS system to operate smoothly. Firefighters and law enforcement are usually the first to be on scene. The emergency medical responder is a key element in providing emergency care. Advanced life support ambulances are usually the patient's second contact with the EMS system. EMS systems are regulated by Florida Statute Chapter 401. The Florida Department of Health then creates rules to administer Chapter 401, known as 64J. All skill levels are based on what is learned as an emergency medical responder: airway control, bleeding control, prevention, recognition, and treatment of shock. To ensure quality management of the EMS system, all fire districts and EMS share the same policies and procedures established by the medical director, known as protocols. Because the DeWitt Fire District is located so far outside of town in a rural area, it is your responsibility as an emergency medical responder to know these protocols so you can evaluate, stabilize, and treat patients using a minimum of specialized equipment and to help EMS when they arrive on scene. A call to 911 activates the EMS system. An emergency communication center or public safety answering point, otherwise known as PSAP, receives the call reporting an incident. Within our EMS system, the Manatee County Emergency Communication Center is a nationally accredited dispatch agency with highly trained emergency medical dispatchers utilizing the Priority Dispatch System. This system helps dispatchers to process the call, to send the proper resources, and to provide the 911 caller with the initial life-saving information prior to the arrival of an emergency medical responder. Now let's listen in to see an example of how this system works.
Manatee County 911, what's the address of the emergency? And then what's the phone number you're calling from? And your name, please? Are you at that location now?
After the initial location is established, the call taker will continue to ask questions of the caller based upon the Priority Dispatch System. Let's see how this works.
Exactly what happened?
One of his buddies accidentally cut him with a utility knife, I think, on his forearm.
Patient right now?
Yeah, I am.
Okay, how old is the patient?
Mid-20s.
Is he conscious?
Yes, he is.
Is he breathing?
Yes, he is. He is actually standing.
Where is he breathing from?
He is left forearm.
Is he completely awake?
Yes, he is.
Is he breathing normally?
So far, yeah.
Is the blood squirting out?
Yeah, it's kind of coming out pretty good.
Does he have a bleeding disorder or is he on blood thinners?
I couldn't tell you that.
Okay, that's fine. All right, I send the paramedics to help you now. I want you to stay on the phone. I'm going to tell you exactly what to do.
While this may seem like a long and tedious process of questions and answers, the call has already been sent to the dispatcher for processing of the units to respond. Let's listen in.
And they came in with the name and where exactly the general location for the patient would be. It dropped into my pending event. I open up the window, and this is would be the units that would be recommended to the call. Now I would choose the appropriate units based on proximity.
DeWitt volunteer firefighters are notified via their smartphone, and a Manatee County EMS Alpha unit will be dispatched. Because DeWitt is so far out in the rural area, the emergency medical responder plays a critical role in patient care.
ECC Engine 1611 responding.
The DeWitt emergency medical responder will arrive on scene, access the patient, assess, take initial vital signs, provide initial medical care, and relay patient information to the responding medic on TAC 5. For example, Alpha 20 from 1618, we have a 69-year-old female who's conscious and alert, complaining of chest pain and shortness of breath that started approximately 15 minutes ago. The blood pressure is 130/70, the heart rate is 88, the respiratory rate is 16, and the O2 saturation is 94%. The Alpha unit will acknowledge, may request more information, or direct you to perform some type of patient care. Always repeat the orders back to the Alpha unit so they know you understood what was asked. 1618 copies will go ahead and assist the patient with their nitro. When EMS arrives, they will take over responsibility of the patient. You will relay any additional patient information you found and assist EMS as needed. EMS will then assess the patient, address any critical patient needs, and determine the proper destination for this patient based upon the problem. Some situations will require a rapid transport to the hospital, such as chest pain presenting as an ST segment elevation myocardial infarction, or STEMI. And don't worry, as an emergency medical responder, you don't need to know all the technicalities. Just understand that chest pain that is called a STEMI will require rapid transport to a facility that has a cath lab for the proper patient treatment. Another rapid transport situation will be trauma alerts based upon Florida criteria. A trauma alert or multi-system trauma will need surgical intervention right away at a facility that has surgeons available immediately to perform these life-saving interventions. Another rapid transport decision is made for strokes. With paralysis on one side where they can't hold up their arm, slurred speech, a drooping face, and after the blood sugar is determined, these patients will need to be rapidly transported to either a primary or a comprehensive stroke center if the signs and symptoms are less than 24 hours old. Other situations may include poisonous bites and stings, and sepsis, an insidious killer that occurs when an infection happens in the body that spreads to the bloodstream, triggering an inflammatory response throughout the body, thus shutting down organs. As an emergency medical responder, and because DUET is so far away from various medical facilities with specialized treatments, you're the key. The better picture you paint to the responding Alpha unit, the faster resources can be brought in for rapid transportation. All other stable patients will be transported to a local hospital by EMS, where their care is followed up with by the nurses and doctors of that facility. And that concludes the EMS system of DUET Fire Rescue.